What is risperidone and how does it help with autism? Have you ever wondered how certain medications can support children with autism spectrum disorder? Today, we will discuss risperidone, a medication that many families consider for managing specific behaviors associated with autism. Risperidone is an atypical antipsychotic medication, also known as a second-generation antipsychotic. It was developed in the early 1990s and is often prescribed under the brand name Risperidone. While it was initially approved for conditions like schizophrenia and bipolar disorder, it is also approved by the Food and Drug Administration for managing behavioral symptoms in children and adolescents with autism spectrum disorder, particularly those aged 5 to 16 years. It is important to note that risperidone does not cure autism. Instead, it helps manage challenging behaviors that can arise with autism spectrum disorder. These behaviors may include irritability, intense tantrums, aggression, mood swings, and self-injurious actions. The way risperidone works is by modulating the activity of neurotransmitters in the brain, mainly dopamine and serotonin. These chemicals influence mood, behavior, and cognition. By reducing the overactivity of these neurotransmitters, risperidone can help decrease irritability and aggressive behaviors, as well as reduce repetitive and stereotyped behaviors common in autism. Clinical studies have shown that risperidone can significantly reduce tantrums, aggression, and self-injury in children and adolescents with autism. For instance, trials have reported about a 57% reduction in such behaviors compared to a much smaller improvement with placebo. These improvements have been observed in both the short term, around 8 weeks, and sustained over longer periods, up to 6 months or more. Risperidone has also been shown to improve hyperactivity and stereotypic behaviors, although it does not significantly change social withdrawal or communication difficulties. While there are benefits, it is essential to be aware of potential side effects. The most common side effect is weight gain, which is usually mild to moderate. Other possible side effects may include drowsiness, increased appetite, and hormonal changes. Because of these risks, risperidone is typically prescribed when behavioral symptoms are severe and do not respond well to non-medication interventions like behavioral therapy. From the perspective of autism support and family resources, risperidone is considered a helpful tool for managing difficult behaviors that can interfere with learning and social interaction. It is often used alongside educational and therapeutic approaches to help children with autism better engage with their environment and reduce distressing behaviors. Families and caregivers should work closely with healthcare providers to monitor effectiveness and side effects, ensuring the medication is part of a balanced support plan tailored to the individual needs of the person with autism.